even when compared to suicide victims who were not abused. I mean, that's not, I mean, obviously the suicidal victims had lots of problems or they probably wouldn't have committed suicide, but we don't know the details of that. At least I don't. I actually put in a phone call to people up there in Canada, but haven't gotten a return call yet. Okay, in any case, what I'm trying to say here is there's incontrovertible evidence of physiological differences caused by the abuse itself, and this further undermines the ability of these people to cope with stresses in life. It is not unreasonable to conclude that people with such brain abnormalities will be less likely to initiate and plan a course of legal action because they find it more difficult to deal with stressful situations as a legal case might present. At this point, if you're talking about a level playing field, it's looking less and less like a level playing field. And I'd like to make an analogy here that in most school systems in our state, we make allowances for children with attention deficit disorder or learning disabilities and give them more time to complete their exams and assignments because our sense of fairness dictates that they should not be discriminated against because their disability hinders them from accomplishing tasks in a certain time limit. Well, I think the analogy applies here. The time limit is a statute of limitations. So we need to push that back in the same way that a child in 3rd grade who has attention deficit disorder is given more time to finish his assignment.
Doctor, that's in your, I'm not following.
Yes,
I'm
yes.
listening. It's
Yeah,
in here.
yeah, it's in there. Yeah, page 3. Okay, let's see. We have some more things. And another study here, this one in the Journal of the American Medical Association. Dr. Paris discovered increased somatic disorders in victims of sexual abuse. Again, well-designed study comparing them with people who had not been abused, and a lot of gastrointestinal problems, chronic pain, psychogenic seizures, and on and on. I mean, I think we've already, the people who have participated so far have enumerated lots of other things. Smoking, proclivity to HIV/AIDS also. I mean, I think that doesn't cost a lot to take care of that. Of course it does. So this is the fallout. This is the damage that is strewn about from the sexual abuse phenomenon. Okay, let's see. Oh yeah, I also had contacted a district attorney out in Minnesota because he's been very interested in this topic, and I've included some of his results here. He took part in the Minnesota Interagency Task Force on Domestic Violence and Sexual Assault Prevention. And he has some more statistics, again, that are consistent with other things that have been said here. So I won't go into those in great detail. Let's see. Okay, I think that's probably, I would say, okay, as a group, the victims of child sexual abuse, our population whose capacity to take legal action has been impaired by the very crimes committed against them. And it just seems that in basic fairness that this would prompt the state to substantially expand the statute to allow them to pursue litigation when they have recovered sufficiently to be able to do so. It has been demonstrated by some of the studies above that they have a reduced capacity to tolerate stressful situations, yet our current laws require them to take legal action without due consideration of this fact. Now, a couple of other, the question of the window has come up, and I think the other thing to point out here is the experience of 2 states that have passed a window, California and Delaware. And we have, some people have looked into this, have indicated that there are 963 predators were identified in California during the 1 year that the window had been enacted, and 150 in Delaware, a much smaller state, in their window. So, and we know that sexual predators have multiple victims. So if you take that figure of 963 and you multiply it conservatively by 8 or 10, you're talking about thousands who had been abused, and so therefore taking them out of circulation is going to protect potentially thousands of kids in California. The other comment I wanted to make here is in reference to some of the questions that came up earlier. One was the guilt feelings of parents. I did have a case where a mother, her child had been abused, and it wasn't it was more of a combination of actually physical and, not that that's any better, and psychological abuse in a nursery school. And the little girl was 4. And again, I mean, this is relatively minor in comparison to some of the abuse that has happened. But this woman had tremendous guilt because even if it was no fault of hers, she felt that she had failed to protect her daughter. Why didn't I catch on to these people? Why didn't I see through their baloney? Why didn't I, I'm a bad mother. I'm not doing my job. So you can see where, if you expand this and magnify it many times over, how parents will feel tremendous guilt, and they have to they need help in dealing with that. And also, someone had brought up the impact of what happens when the child finally discloses, or even a teenager or a young adult discloses, and is not believed. And there is research to indicate that that intensifies the symptoms of post-traumatic stress. So, and that happens. That's a fairly frequent occurrence. So I think I've pretty much covered what I wanted to cover, and be glad to take any questions. Thank you.
Thank you again. What can I say? You've really done your homework and given us a lot to think about. We appreciate it. Thank you very much.
Thanks.
Our next panel, last panel, is Michael Polenberg, the Vice President of Government Affairs at Safe Horizon, Harriet Lessel, Executive Director of the New York City Alliance Against Sexual Abuse.
Okay. I was going to say good morning, everyone, but it has turned into the afternoon. So thank you, Chairman Lentil and Assemblymember Markey, for the opportunity to testify at today's hearings. I will keep my remarks brief. My name is Harriet Lessel. I'm the Executive Director of the New York City Alliance Against Sexual Assault, and I'm also the co-chair of the Legislative Committee of the Downstate Coalition for Crime Victims. The Alliance's mission is to build the capacity of communities, organizations, and institutions to advance the right to live free from sexual violence and reduce the harm it causes individuals, families, and society. We accomplish this through research, training, and technical assistance, policy advocacy, capacity building, and public education. The Downstate Coalition for Crime Victims of New York State consists of organizations, service providers, victims, victim advocates, government agencies, and elected officials who are committed to ensuring accessible and equitable services for crime victims in New York State. The Child Victims Act continues to be a priority bill for both the Alliance and the Downstate Coalition for Crime Victims. Why? Because of our commitment to justice, safety, security, prevention, and compassion. I'll speak briefly about justice first. Sexual assault and abuse, as you know and as you have heard today, are the most underreported of all crimes. In recognition of this fact, significant efforts have been made to make both the criminal and civil justice system more accessible in order to encourage more victims to come forward. This includes the development of specialized law enforcement and prosecutorial units, some of which you've heard from today, counseling programs embedded in prosecutors' offices, the development of specialized forensic examiner programs in hospitals and best practice child advocacy centers, and the development of skills within local rape crisis programs to use their knowledge about rape to treat adult survivors of childhood sexual abuse. And all the changes in laws to address the challenges in prosecuting sexual assault and abuse. So we know that, one change of statute is that the statute of limitations for first-degree felony was eliminated in 2008. Safety and security. Research on repeat victimization demonstrates that people who have been sexually assaulted once are at higher risk to be assaulted again. And I'm quoting here from the study that is cited in my remarks. The rate of repeat victimization is the percentage of incidents of a given crime type that are repeated against the same person or households within a given time period. Of the crime types covered in the survey, sexual incidents consistently have the highest rates of repeat victimization. Between 40 and 50% of sexual incidents were repeat incidents against the same woman for each sweep of the survey. For anyone interested in preventing further victimization, ensuring that victims of child sexual abuse get help is a very powerful strategy. And when victims have access to the criminal and civil justice systems, they're also more likely to receive other kinds of treatment and intervention. Compassion. In the debate surrounding the Child Victims Act, it appears that an understanding that a heinous crime was committed on children has been lost. To address the needs of victims and why we should all ask for compassion, I'm going to quote from an article briefly, The Relationship of Adverse Childhood Experiences to Adult Health, Turning Gold into Lead by Vincent J. Felitti. The question of what determines adult health and well-being is important to all countries. The Adverse Childhood Experiences Study is a major American research project that poses the question of whether and how childhood experiences affect adult health decades later. The study reveals a powerful relationship between our emotional experiences as children and our physical and mental health as adults, as well as the major causes of adult mortality in the United States. It documents the conversion of traumatic emotional experiences in childhood into organic disease later in life, so not just mental health issues, but health issues. How does this happen, this reverse alchemy, turning the gold of a newborn infant into the lead of a depressed, diseased adult? The study makes it clear that time does not heal some of the adverse experiences we found so common in the childhoods of a large population of the middle-aged, middle-class Americans. One does not just get over some things not even 50 years later. We don't have time to review in detail the findings from the Adverse Childhood Experiences Study, but I would certainly refer and encourage anyone interested, to be able to look it up. And I also don't want to suggest that people who experience childhood sexual abuse cannot have happy and productive lives. Many of them do so. But what it tells us most definitively is that sexual abuse in childhood has powerful consequences later in life, and that we as a society have a responsibility to not only address the prevention of childhood sexual abuse, but to provide the resources that all survivors need to become the best that they can be and to live productive and fulfilling lives. Imagine what could be accomplished in our world if everyone who is sexually abused was accomplishing their life dreams instead of spending their time recovering from the abuse. Thank you.
Mr. Polenberg?
Thank you, Mr. Chairman and Assemblymember Markey. My name is Michael Pollenberg. I'm Vice President of Government Affairs for Safe Horizon, the nation's leading victim assistance organization and New York City's largest provider of services to victims of crime and abuse, their families, and their communities. I'm going to try to get through the testimony quickly. Safe Horizon supports extending the statute of limitations by 5 years to allow adult survivors of childhood sexual abuse additional time to pursue criminal damages, though I will say, having heard all the testimony here today, I'm thinking 5 years is awfully modest.
It is a beginning. That's what it is, a
exactly.
beginning.
We also support allowing adult survivors an opportunity to pursue civil damages. We recognize and appreciate very much that the effort to pass such a measure into law is not without controversy. But we remain hopeful that all sides of this debate can agree that childhood sexual abuse is a heinous crime that often debilitates its victims many years, even decades after it ends. This is a story of a woman named Kathy, obviously not her real name, who came to our licensed Article 31 mental health clinic, which is located in downtown Brooklyn. She was 25 when she was referred to Safe Horizon from a nearby hospital. She was pregnant with her first child and was having a routine doctor's exam when she broke down into uncontrollable tears. She told the Safe Horizon counselor that she had been sexually abused by her own father from the age of 7. He forced her to silently suffer through repeated rapes by threatening to inflict the same abuse on her younger sister. When Kathy was 12, she discovered to her horror that her father had in fact been raping her younger sister all along. Desperate to protect her sister and herself, Kathy garnered her strength and told her secret to the one person she trusted more than anyone else, her grandmother. But instead of believing, comforting, or protecting her, Kathy's grandmother denied that her son could ever be guilty of these kinds of things and warned Kathy that if she ever spoke of this again, she would bring shame not only to herself, but ruin to the entire family. Kathy didn't speak of this again until she found Safe Horizon 13 years later. After years of repression, shame, self-doubt, and denial, Kathy sought support from our counseling center to come to terms with the emotional trauma of the abuse. Through working with her therapist, she concluded that it was the reality of bringing her own child into the world that caused the crisis that finally got her the help that she needed after so many years. Because Kathy was 25 years old, She was 2 years too late to file criminal charges against her perpetrator.